This is the Voice of Health, sharing health principles, inspiring healthful living, because a healthy lifestyle is medicine. Broadcasting every Monday, Wednesday, and Friday at 11 a.m. Brought to you by the Lifestyle Medicine team of Adventist Medical Center Manila, Health Ministries Department of North Philippine Union Conference, Adventist World Radio, and Hope Channel Philippines. Hosted by Miss Lady Mataya Dapat. This is the Voice of Health.
Isang masaya, masigla at malusog na araw po sa inyong lahat. Welcome to the Voice of Health, trumpeting heaven's prescription that your lifestyle is medicine. Sa araw na ito, panibagong linggo na naman ang ating sisimulan ng isang napakagandang topic na walang iba kundi aging gracefully. Sino nga ba naman ang ayaw mag-age gracefully, di ba mga kaibigan? Kaya kailangan talagang mapag-usapan natin ang ganitong mga klase ng topics. At syempre, sino pa ba ang ating iimbitahin kundi isang dermatologist? Siya ay isang fellow of the Philippine Society of the Philippines, at international fellow of the American Academy of Dermatology. Isang consultant dito sa Adventist Medical Center Manila, si Dr. Philip Buñag.
Hi, good morning, lady. And good morning to all of you.
Thank you so much, Doc. Alam kong very busy ka, marami kang pero talagang napagbigyan niyo po ang Voice of Health.
Yes, yeah, because this is something very important naman to, not only to us dermatologists, but to everyone.
Totoo yan, Doc. And your topic, kanina ko pa po sinasabi na talaga I'm so excited kasi ang ganda ng aging gracefully.
Yeah, because aging naman gracefully, my lecture is not just about keeping wrinkles at bay, but of course as a dermatologist, I will be talking on more about it, but aging gracefully actually is more of, not trying to look like 20-something, but it's about having your best life and enjoying it, So those are the things that I will also touch on.
Wow, that is so exciting. Yeah. Kaya mga kaibigan, i-share nyo na ang ating live stream program today. And we are live at GSAT Channel 37, Local Channel 45, at sa mga Facebook pages under the North Philippine Union Conference. Especially, I'm watching and talagang nakatutok for your questions and comments sa Facebook pages ng Adventist Medical Center Manila and Hope Channel North Philippines. Bago tayo magtuloy-tuloy sa napakaganda nating pag-uusapan ngayon, panoorin nyo muna ito.
Lifestyle is medicine. L is for laughter, the stress reliever. I for interaction, the friendly immune booster. F is for food and fluid, the taste of health and the thirst quencher. E is for exercise, the preserving power of motion. S is for sleep, the body restorer. T is for temperance, the key to balanced life. Y, your faith, the divine healer. L is for light, the energy giver. And E, environment, the lifesaver. Pure air, sunlight, abstemiousness, rest, exercise, proper diet, the use of water, trust in divine power. These are the true remedies. Indeed, lifestyle is medicine.
At yan nga po ang video ng Lifestyle is Medicine Intervention Program, our program here at Adventist Medical Center Manila na online. And ito po ay 6 weeks lamang, Tuesdays and Thursdays, 6 to 9 p.m. So, sa pamamagitan ng 12 sessions na yan, marami na po kayong matututunan at lungan po kayo na mag-jumpstart into a better lifestyle kasi nandyan ang laughter, interaction, food and fluid, exercise, sleep, temperance, your faith, light, and environment. At marami pa pong iba kasi may fitness instructions and cooking demonstrations na kasama. Watch out for more information about the coming batch ng Lifestyle is Medicine Intervention Program. Pero sa pagkakataong ito, ituloy na muna natin ang napakagandang topic ni Dr. Philip Buñag on aging gracefully.
Okay. So, lady, I'll start the lecture. So, this morning, I will be discussing the topic aging gracefully, no? And as I've said, aging gracefully is not about trying to look like 20-something. It's about living your life, your best life, and having the physical and mental health to enjoy it.
Yes.
No? And when you have this happy and healthy life, then you may be able to keep the wrinkles at bay. So it's not just all physical.
Yes.
Okay. So this is my disclosure. I'm the Assistant Medical Director of the Bello Medical Group. I'm the Medical Director of the ZO Medical Products. And then the agenda for this morning would be, of course, definition of aging, aging gracefully, types of skin aging, physical and biochemical changes due to aging. Because I'm a dermatologist, I will discuss more on the skin, and then how to age gracefully, and how to select anti-aging skincare. I mean, if you don't have time to see your dermatologist, and para hindi maging hit or miss yung pagpili nyo ng over-the-counter products, and then how to maximize results from anti-aging skincare products. No? And then, of course, we'll talk a little about UV light and sunscreens, you know. So, aging actually is a present participle of age, no? And grace is a Latin term meaning gratus, so it means feel good about yourself. So that's actually aging gracefully, no? And then, in fact, I have a quote here from Audrey Hepburn and from George Bernard Shaw, no? That, and the beauty of a woman with passing time, years only grow. And then for George Bernard Shaw is, you don't stop laughing when you grow old. You grow old when you stop laughing.
Wow. It really makes sense itong mga quotes na to. And they are figures talaga sa society natin that represents
that's why.
beauty.
So, it's more of a holistic approach. Okay? And then, of course, aging gracefully, this is the one that the main topic, no? So first is be kind to your skin, which, of course, as a dermatologist, I will be talking more about it later on. And then, of course, you have exercise and stay physically active, because we all know that exercise and being active can prevent a lot of chronic diseases like heart disease, diabetes, and if you're also active, then your stress level also goes down, no? And then, of course, number 3 would be mind your diet. Okay, so healthy foods, you know, like fruits and vegetables, and then lean proteins, and at least 3 ounces of whole grain cereals and things like that, no? And then uh, 3 servings of low fat, and probably fortified with other vitamins, especially vitamin D, no? So, it's not only physical, but what you also put in yourself,
Yes.
diba? What you take in, that will also influence how you will age.
Alam mo, Doc, ang
Okay.
ganda nung, grabe mga kaibigan, no? Nagsisimula pa lang tayo, pero full of information and content na yung natututunan natin from Dr. Philip. And I totally agree, Doc, dun sa sinabi nyo na talagang be kind to your
Be
skin.
kind to your skin.
I think that's one thing na parang gusto lang ng karamihan namin na paano ba to? Lagyan mo lang ng lagyan ng products, ganyan. Pero hindi pala,
Pero hindi, no? That's why nga
Hindi.
later on, if you don't have time to go to a dermatologist, I will also give some pointers on how you can choose your over-the-counter products.
Pero one thing na I really got from what you said, Doc, yung lifestyle talaga, first line of defense and also first line of self-care.
Yes. Yeah.
Hindi lang siya, I always hear about lifestyle like exercise, yung sleep, yung stress. Kahit sinong doktor na maging guest natin dito sa Voice of Health. And even pala sa pag-age gracefully.
Yes. Diba? And then, aside from your diet, mental health matters. Okay? So, you have to be being happy and keeping your stress down. Okay? So, spend time with friends and family, your loved ones.
Grabe,
you know?
kasama rin yan.
So, kasama rin yan, no? And then, of course, after that, you have the... you have to accept your age, your numerical age, you know.
Oh my, that's an
because that will
eye-opener.
also relieve more of the stress, you know.
Okay.
And then, of course, do the things that you enjoy, you know, because these are all lowering your stress level, okay? And of course, stay physically active, as we have said earlier. And then, lower your stress by, you know, techniques like meditation, yoga, being prayerful, and adequate sleep. Talking to a friend, you know, will also matter, you know, because you're able to connect with some
Yes.
people, okay? And then, of course, you quit smoking and decrease alcohol consumption, and then get enough sleep,
Wow.
okay? We all know that 7 to 8 hours of sleep is recommended for adults, no? And good sleep, meaning not just sleeping, but it has to be restful and
Talagang
good
sound
sleep.
sleep.
Yeah. Oo.
Meron kasing, you're right, Doc, meron talagang nakatulog, pero restless pa rin pagkagising.
Yun, because hindi siya good sleep, di ba? Oo. And then, of course, find new hobbies.
Okay.
You know, as you grow, you want to do the things that probably you want to paint,
Okay.
or you want to do some handicrafts, or this will actually, you know, help you age gracefully without you realizing it, no? And then practice mindfulness.
Wow.
Meaning you have to accept and live in the moment. You know, because sometimes we worry too much.
Yes, when we think of the future,
Or
like, what if?
Yeah, we think of so much of the past, the what if I did this, and then worry about the future, then we don't enjoy the moment.
Yes.
You know, so that's being, be mindful of the present, you know, so that you'll enjoy life, you know. And of course, you drink plenty of water,
Okay.
you know, and see a doctor regularly, you know. Sometimes a lot of people will only see a doctor when they're feeling something.
Yes.
But of course, as we mature or as we grow, sometimes it's also nice to see like yung mga parang executive check-up,
Right.
you know, for you to be able to see if there's something wrong,
Preventive approach yan,
preventive
Doc, eh.
approach, 'di ba? Not only when it's already grabe.
At minsan, or madalas,
Yun ang
we tend to
nangyayari.
go to the doctors pag masakit lang.
Yun.
Pag
Or,
walang masakit,
yes.
kapag hindi nahihilo.
Or grabe na.
Yes, pag hindi pa malala, wala.
Yan.
Okay lang,
In
o
fact,
kaya
you know,
pa.
I see that in a lot of my patients. Like, of course, they always they come to me for the skin, no? If it's about the skin, 1 or 2 days, they will see a dermatologist right away. But from my history, I will tell them, meron ho ba kayong diabetes? Meron ho ba kayong hypertension? Oho, pero hindi na ako pumupunta sa cardiologist ko, sa endocrinologist ko kasi wala naman akong nararamdaman eh. Taon na akong hindi. So I still have to educate my patients na alam niyo po, mas importante yan kasi these diseases can be parang, these are what we call mga traidor na sakit, no? You don't feel anything.
And then pag biglaan,
Yes. So I urge them to really see again their cardiologist, their endocrinologist. Tapos sinasabihan ko pa sila na eto nga ho, pag skin, 3 days pa lang, andito na agad kayo sa akin eh. So, mas importante po yon. So,
Yeah.
it has to be a holistic approach, you know. So, yun yung
one thing I
natin.
also got from what you said, Doc, merong mga tao na they go to the doctor because they see something is wrong.
Yes.
Sa outside, because it's their skin, they can see it. Pero they don't realize that it may be connected from something inside.
That's also naman true, no? That's why it's also good to see a board-certified dermatologist because there are a lot of diseases that may manifest initially on the skin.
Okay.
Then, if you see a board-certified dermatologist, that dermatologist will be able to really dig deeper and not only treat what's being seen on the
Yes.
skin, no? In fact, and if we need to refer it to another specialty, like rheumatologist or cardiologist, then you get a better outcome
Yes.
of treatment, you know? Okay. So,
Amazing.
now we go to the skin.
Okay.
Okay. Types of skin aging, you have intrinsic or chronological aging, no? This is more genetics, okay? So, this is the result of passage of time. And this is inevitable, you know? Sometimes we cannot really do something about it, no? In fact, the joke there is choose good parents so that your genetics will be very good, no? So you see exaggeration of expression lines and things like that, no? On the other hand, the other type of aging is the extrinsic aging or photoaging. So this is the one that we can really do something about because this is not inevitable. So this is where the be kind to your skin
Yes.
comes in, no? So you, especially exposed areas, you know, sunlight, UV light is from the sun, you know, we love the sun, but we don't protect our skin and things like that, no? And of course, smoking, alcohol, poor nutrition. So all of these things will actually affect your skin, no? So these are the two types of aging, the intrinsic and the extrinsic aging. But the extrinsic or photoaging, we can do something about it.
Yes.
Okay? And then, of course, this is just to show our audience what happens with aging. If you look at it under the microscope, especially the collagen and the elastic fibers, it's already dystrophic, no? Hindi na maganda yung pagkaayos niya sa aged skin, no, compared to a young skin, no. And then there are physical changes due to aging, surface changes. We will see wrinkles, sagging or slack skin, and then loss of firmness or tension. Then you see wrinkles, no? And then you have thinner and thicker or thicker skin depending of the type of aging. So your skin barrier function is also affected, no? And then loss of fat, so wala na yung cushion effect, no? And that also makes your skin wrinkled, no? Because look at the baby, if you pinch the baby's skin and parang snap it,
Yes.
it goes back right away, di ba? It's so elastic, no? Parang ganyan lang and then it goes back. That's the perfect skin, di ba? But if you're aging already, when you pinch it, it takes time for it to go back, no? Kasi wala nang yung hindi na siya ganon ka-elastic, no? And then, of course, rough texture, no? So, that's why sometimes, especially in very cold countries, moisturizing the skin is important, or humectants, no? Very controversial kasi minsan yung moisturizer, no? Sometimes, especially among girls, parang it's always a must that they use a moisturizer on their face. When sometimes, the moisturizer actually acts only like a band-aid. But may problema pala that you're not addressing. So you might as well address the main problem instead of just putting a band-aid.
Wow.
You know? And then, our skin kasi, especially in a tropical country such as ours, ang weather natin is not too cold, no? And it's not too dry, no? So parang ang skin natin, meron tayong normal factory of moisture and water. But if you put too much moisturizer, yung signal na nakukuha ng skin mo, oy, we have too much water, we have to stop.
Okay. So when we stop
So
using
when you stop the moisturizer, yung factory mo ng natural moisture, nag-stop na. That's
So
why
dry.
it's too dry. Then you go back to the moisturizer, no?
Okay.
So it's a vicious cycle. That's why if there's a problem, treat the problem.
Okay.
You know, it's not a band-aid thing that you need to do a moisturize right away.
Alam nyo,
Okay.
this is why we need to listen to board-certified dermatologists.
Yeah.
Instead of just looking at advertisements
Yes,
and videos from
yeah,
anywhere. Kasi
yes.
these are the things na hindi natin maririnig from them na eto band-aid lang pala to. Where in fact,
Yeah.
anywhere you see it, sasabihin, you need this, you need this, you
Because
need
if
this.
there's a problem, then you treat the cause of the problem.
You treat the cause of the dryness,
Yes.
of the whatsoever.
Of the sensitivity of your skin. But sometimes you just put on moisturizer, so nawala na yung, medyo nawala yung redness, nawala yung scaling, but you're not actually treating the, so it's more of a band-aid
Yes.
solution, no? And then, of course, there are color changes also due to aging. You have pigmentation, especially if you expose under the sun without sunscreen. And some people are more prone to pigmentary problems. And uneven skin tone, nag-iiba-iba na yung color and things like that. And of course, dull or lackluster skin. Wala yung glow. No? Your skin should glow, you know. And it's parang like, of course, your inner glow will also reflect on your skin, But it's also different if you have a glowing skin rin naman outside, no? And of course, you have your capillaries or small blood vessels sometimes are brittle already. That's why you have mga blotchy redness on the skin. So these are part of aging, you know, that can actually be remedied early, no? So in fact, there are biochemical changes due to aging. Ito na nga yung sinasabi namin na reduction in everything good. Okay? The collagen and elastic production, yan na ano yan, no? Naapektuhan yan. And then, you have the, hindi ko masyadong makita. And then you have the,
Yung time natin, all right. Thank you so much.
so you have the collagen and elastic production, and then the
We have here yung
Seeing-
blood flow, energy production,
seeing ano no yung
slower cell turnover. As
yeah,
I'm reading it on
skin's
your
ability to bind water, you know, yan na yung sinasabi ko, di ba? Na pag nasira yung ability of our skin to bind water, then it becomes so dry, you know? And sometimes we only use moisturizer agad, you know? And then you go into that vicious cycle. And then, of course, yung lipid production, which also contributes to the glowing skin, no? And then skin barrier function is weakened. So, nagiging mas sensitive yung ating skin, no? As we grow older. And then we have the blood flow, which actually we know is the one that brings nutrients to the skin. So then it also affects the appearance of the skin, energy production, then the repair of the cells will also be sluggish, and slower cell turnover, and improve the immune function is impaired. So of course we get a very sensitive skin also, and formation of senescent cells, or these are aging cells. So yun yung mga biochemical changes that we see, no,
Ang dami palang
an
nangyayari
aging skin.
talaga
Maraming
sa isang
nangyayari.
aging skin.
And you have to look into all these things, no? And then, in fact, how to age gracefully in your 20s? Okay. Hirap na.
Alam mo, Doc, I'm really excited, thrilled to ask questions in my head.
Yeah, okay.
And I would like to ask the audience, kung meron kayong mga tanong, comment it sa Facebook pages ng Adventist Medical Center Manila and Hope Channel North Philippines. You can see here na binabantayan ko po ang mga pages na yan para sa inyong mga katanungan.
Yeah, okay. In fact, I saw these things, no, how to age gracefully per decade, no.
Okay.
This is by actually Dr. Elaine Cook, an American dermatologist. And then for 20s, you have to use sunscreen. Okay? And then don't tan.
Okay.
Buti nga sa Philippines, hindi uso ang tanning centers, no? But abroad kasi uso yung mga tanning sessions, no? But that's a no-no talaga for the skin. And of course, don't smoke, don't abuse your alcohol or drugs, you know. So, healthy lifestyle pa
That's
rin,
right.
diba? And then, you can now start retinoid, or start early. These are the retinols, no, that you can read on the labels of your over-the-counter products, no. So, and then you control acne if you have acne, so you can prevent scarring early on, no, because one of the major reasons why we treat acne is to put it to a minimum and to prevent scarring. Because once it has scarred, of course, nowadays, a lot of things can be done, but sometimes it can be very expensive. But if we can prevent it,
That's right.
you know, because usually this starts mga during adolescent period, di ba? And a lot of parents would say, hindi, ano lang talaga yan.
Mawawala
rin yan, no? Hayaan mo na lang yan. Which is sometimes true, no? Because sometimes after adolescent period, the hormonal changes would stabilize, nawala. But marami namang nagka-scars, no? So, the role of a dermatologist there, seeing acne patients, especially among adolescent patients, would be to put it to a minimum and to prevent scarring. That's our goal talaga. And then, don't pick on your skin because picking on it will really make it worse.
Taas ang kamay ng mga guilty.
Oo, yeah. Sometimes I tell my patients, paglayuin niyo po yung kamay niyo, and sometimes you do it unconsciously. No? Pag wala kang ginagawa, nanonood ng TV in the evening, or
parang
patulog na, you know. So, these are the don'ts that you should, and start using active skincare, you know, even in your 20s, you know. And pick a good product. You know, because nowadays we're bombarded with so many things, you don't know which to choose. That's why later on I will give a tip on how to more or less start it if you don't see a dermatologist.
The joke is here, Doc, pick good parents. But we can...
Exactly, okay. And start non-surgical treatment if you need to. You know, like late 20s, you may have some fillers or Botox, but you know that's going to the other extremes, no? But you have to take care of the skin. The important thing to remember is as early as teenage years and early 20s, you really have to take care of your skin already.
It should be there, hindi yung late mo na maisip. So, better early pa rin
Better
talaga.
early pa rin. Okay. And then, in your 30s...
Okay, here we go. 30s na.
Okay. Again, be kind to your skin. You exercise. So, nandun pa rin yung holistic approach natin, no? Mind your diet. Nandun pa rin. Especially if you're older, di ba? Kasi yung diet natin, when we were younger, wala tayong pakialam sa diet natin. But
That's
of course,
so
as you grow older, you now have to be more conscious about it, di ba? And mental health, you know, it matters, especially now, no? What we're experiencing worldwide, the global pandemic. Without us realizing it, it really has an effect on our mental health. No, not only we may not be so conscious about it, but it does. No, so I think mental health now should really be looked into. No, even among children that they cannot go out, they don't go to school. We think that it's just okay, but there would be an effect on these children. You know. So, let's hope that this pandemic will end soon. Right. Okay? And stay physically active, lower your stress, but it's not that easy to do. And quit smoking and decrease alcohol and get enough sleep. No? And of course, you can now use your tretinoin that you've started in your 20s, or continue with your fillers, your Botox, and things like that. No? There are so many things that you can now do, actually, non-invasive. No? There are so many lasers that you can actually do to actually beautify the skin. But of course, as I've said, it's not only the physical aspect that we're after here, no? And then not all people naman can actually afford it. That's because it may also be very expensive. So you might as well start early taking care of your skin. be kind to your skin, diba? And in your 40s, then you have this, what they call this, plenty of water in your 40s, and then exfoliate. You need to exfoliate already.
I have a
on your
question on
skin.
that, Doc. Like, how many times should they exfoliate?
Not on a daily basis. Okay? Because you're also damaging naman your skin surface niyan, no? Maybe once in 2 weeks,
Okay.
you know, because our skin regenerates naman you know, 20 to 2 to 3 weeks. That's a normal regeneration time, no? Yung exfoliation naman, we're just trying to help them. Because minsan as we age na, hindi na normal yung exfoliating time So we're trying to help them lang, no? But don't be so harsh. Because if you're so harsh naman, then you're damaging it also. Be also gentle.
Yes.
Okay,
Be
when
kind
you're
and gentle to the
exfoliating.
skin.
And of course, you can hydrate if you need to, but don't overuse it. And don't make it your moisturizer, don't make it a go-to thing.
Because sabi nyo nga, it will change the signals.
And you might damage your skin more because if there's a problem, then you direct your action in relieving the main cause. Okay? Not just covering it up. Okay? And then, of course, sunscreen is very important. And then, you can have laser treatments now in your 40s, or in fact, even some would opt for minor surgeries, you know, like if you need blepharoplasty, you know, and things like that. Why not? You know, if you can afford it. There's really nothing wrong in having all these cosmetic procedures, you know.
I agree.
If it makes you feel good, then why not? And you can afford it, why not?
And I have seen
You know.
videos, Doc. It really changed lives of people. Like,
Yes.
maraming bullied when they were young.
Yes.
And then the cosmetics, what do you call this, Doc? Yung mga procedures have changed their lives talaga for the better.
In fact, sa cosmetic procedures naman kasi parang, like at Bello, for example, no? We also look at the motivation of the patient. Because sometimes mali yung motivation. You know, especially among girls, you know, na they think that changing something would make, sorry to say, some, they make their husbands more faithful. But it will not, you know. So your reason should be, you're doing it for yourself. Because you want to feel good about yourself. Not for something else that will not actually be remedied by the cosmetic procedure.
Ang lawak pala, Doc, no? When you do also procedures, yun nga at Bello also,
Yeah,
as a dermatologist, talagang you also consider pala the
the psychological
Yes.
of the patient, you know, because sometimes you also want to know why do you want it,
Yes.
you know, kasi ganyan ay hindi ho natin yan masosolve dyan.
So there are times na talagang it's a no-no.
Yeah, kasi parang maano mo lang mafu-frustrate lang siya lalo na hindi pala yun yung solusyon sa problema ko. Parang ganon. That's why the motivation, the right reason to have it is also a very good
Awesome.
thing. Okay. So that's your 40s, no? So the American Academy of Dermatology actually released this, no? How to select anti-aging skincare.
There.
Para nga hindi masyadong maging hit or miss. Kasi ngayon, ganyan na nangyayari. Hit or miss, no? Because these are over-the-counter products and things like that, no? So, but how to select anti-aging skin, this is from the American Academy of Dermatology. So you start with sunscreens, no? And if you really need it, moisturizers or humectants, no? Kasi magkaiba yung moisturizer and humectants eh. Yung moisturizer, sometimes talagang you just put moisture on the but humectant, parang you prevent evaporation too much of the water, no? Plus, of course, you don't overdo the use of it also, no? If there's a problem, as I've said, deal with the problem. You know, that's the time you have to see a board-certified dermatologist. You don't just cover it up.
Yes.
You know, so you start with sunscreens, and the sunscreen should offer all of the following. It should be broad spectrum, not only for UVB, but also for UVA. And of course, lately, not only UVB and UVA, but for visible light. You know, that has been found to be causing also photoaging.
Okay.
You know, and then the SPF or sun protective factor, that number that you see, at least 15 or 30 would be enough, no? But if you have pigmentary problems, may mga pecas, then you may need a higher one, okay? And then, water resistant, okay? Plus, sometimes, the most important thing is, later on, is you use this properly, okay? Because sometimes people will be saying, I use naman sunscreen, but when you ask them, how do you apply it, then you'll know that you're not applying it properly. I love the sun. I always go to the beach. I surf. But I use naman. But when you ask them, how do you apply it, then you'll find out they're applying it the wrong way. And then, of course, these two kasi would actually help minimize fine lines. Okay. And then reapply the sunscreen every 2 to 3 hours if you're really under the sun. No, you don't just apply it in the morning and finish, but you're under the sun the whole day, no? Or you're swimming, kahit na nakalagay na water resistant, you have to reapply because the protection goes down. Okay? So that's the first one, no? When you select your anti-aging skincare. And then next would be, after using sunscreens or humectants or a little moisturizer, then you examine your skin. Ano pa yung problema ng skin ko? So one by one, step by step, parang ganyan. Then, by focusing on one concern, then you'll be able to do something about it. Wala kasing produkto na there's no product that's cure all.
Yes.
If a product promises you na cure all, don't believe it.
Okay.
Yung parang ganyan. So the two reasons for this is no product can treat all signs of skin aging, and using more than one anti-aging product in a few days or weeks can actually irritate the skin naman. So, tambak ka na ng produkto, pwede ka namang ma-irritate.
And naghalo-halo
Especially
na siya,
if you're just doing it by yourself, di ba? You're not under the guidance of a dermatologist. So, yun yung step 2 of selecting anti-aging skincare, no? And then next would be, buy a product formulated for your skin type. So at least you should know your skin type, because if you have dry skin, then you may need some moisturizer or humectants. If you have oily skin, then you don't really need it, diba? You need something else, you know. Or if you have mix, sometimes you have mix only on the middle that's your oily, then you don't put something there that will make it more oily.
Yes.
You know. And then next would be read the product labels and select a product that offers the following. Okay. it should be hypoallergenic. But mind you, you have to be careful because these are all over-the-counter products. Ang hypoallergenic natin dito, hindi siya 100% foolproof, ha? Kasi yung studies na ginawa dito, hindi naman ganon compared to drugs. So hypoallergenic can still cause some allergic reaction, but mas konti.
Okay.
You know, but it's not 100% foolproof that it cannot cause allergic reaction. You know, it just means that the incidence is much, much lower. Because nga, the Food and Drug regulation is not so strict when it comes to cosmetics. Okay? And then, of course, aside from hypoallergenic, non-comedogenic, hindi rin yan foolproof, no? Kasi nga, yung studies naman for a certain product is not so rigid as when it's a drug. Okay? So, you have to, in fact, later on, parang you have to test it, Test first, no? You can test it actually by applying it on your inner arm twice a day for about 5 days to a week. If you're not having a reaction, then you may now apply it on your face, you know, para alam mong hindi ka magkakaroon ng irritation or allergic reaction, no? And there should be a consumer hotline on the product so that if you have some questions or some complaints, then you can call the company and ask them about it, okay? And then, so read the product labels and select the product, okay?
So it's not just about the nice packaging.
Yes, it's not the nice packaging, the advertising, and things like that, you know, because sometimes we live in a world that's full of it, na minsan talagang mapapabili ka talaga.
Yes.
Yung ganyan ba?
Especially pag ang galing nung celebrity na nag-advertise. But the thing is, her skin might be different from ours.
Exactly. See, diba? And then, of course, select the product within your price range. Kasi, hindi naman it doesn't mean that a product that's more expensive is much better than a more reasonable priced product. You know, it doesn't come that way. Plus, of course, the last would be have a realistic expectation naman. Parang all these are just skincare lines that you cannot naman have like a facelift from a cream. You know? And if that promises you that, then don't believe it.
And if don't expect na parang it will change the looks in a week.
in a week or in a day month, overnight and things like that. Hindi naman. It will take
I
time.
look like 20s na.
It will take time. So have a realistic expectation also. So that's how we select the product, no? And then once we have selected the product, okay, the American Academy also released this when you have selected the product, how will you maximize the effect? Okay, it's good for you, and you started using it. So how will you maximize naman the results from the anti-aging skincare products, no? So as I've said, you start with one product naman. Wag yung, ito, maganda daw. And then you're having so many products already and you end up with irritation. You know, it may not be a contact allergy, but it's more of an irritant contact dermatitis, you know. So, paisa-isa lang. So, you know that, So, and test the product before applying to your face, as I've said earlier. You know, you can do that. You test it, no, by yourselves, and then you stop using a product that stings, burns, or tingles.
Okay.
Especially if it's an over-the-counter product.
So, anything na ma-feel naman na grabe, ang hapdi niya sa mukha.
Nag-sting,
parang pakiramdam ko nasusunog yung mukha
yung
ko.
tingle.
Okay.
Yeah. We're talking here of an over-the-counter
Yes.
product. Iba naman yan pagbigay ng ng board-certified dermatologist mo. Because usually, what we give are medicines, drugs, and we know how to use it, and we instruct the patients on what are the expectations and things like that. It may sting, it may tingle a little, then that's okay because it's being given by a dermatologist, no? But yung mga over-the-counter, you have to stop if it stings, burns, or tingles, no? You know, pag mga over-the-counter products lang. And follow the direction.
Yun.
Because sometimes nga we don't read the labels eh. Especially in the Philippines, I think hindi tayo, our population is not yet, maybe late now, the younger ones are the ones really reading the labels and how to use it. If it says, use it once a day lang, wag mo naman going 3 times a day. Yung mga ganyan.
And it doesn't mean na once a day lang, gawin ko nga 2 times a day para mas effective.
Thinking that maybe if I use it 3 times a day, baka mas mabilis. Hindi, no?
Okay.
Irritation can come in, you know, and things like that. So, follow the direction of the product. And then, give the product time to work.
Okay.
Sabi nga natin, wala namang overnight dyan, no? Walang magician dyan, you know? So, sometimes I tell my patient talaga, even sa mga kami, no, diseases na to, no, mga sakit nila, when I ask a patient to come back in a week, pero yung condition nila, months na, yung ganyan ba? And then they expect now, after seeing us, it's gone, no? Doc, meron pa eh. Siyempre naman, you know, I've only seen you 3 days ago or 1 week ago. But it's improving. It's just that it doesn't happen overnight. Hindi ko kami magicians.
Yes.
I tell my patients that, you know. And then, of course, continue using it if you want to continue seeing results. Ito rin yung guilty ang marami. Once they see the result, ay, okay na to.
Tama na.
Oo.
O kaya, change naman ang
Oo,
product.
yan, yung ganyan. Even in my patients, you know, like acne patients, na-control na, ang ganda na, matatamad na sila, yung ganyan, and then, hindi nagagamit, then after 3 or 4 months, eto na naman sila. You know, and I tell them, you know, you have to continue using it. You've reached the goal, but if you want to reap the benefit of it, continue using it. You know, and things like that. Okay, and then of course you protect your skin from the sun, you know, and then hydrators or moisturizers if you need it. Okay, but don't overuse it. Okay. And forget about tanning. Buti nga dito, as I've said, hindi naman sa atin ang Pilipinas. And avoid the temptation to improve results with the do-it-yourself cosmetic procedure.
Oh.
Kasi if you look at social media ngayon, may mga binibentang laser at home, do it laser at home, mga ganyan. Don't, you know. Chances are, more often than not, these are bogus, you know. And, or it can even harm your skin. So, doon ka na lang muna sa mga pamahid, you know. But yung mga procedures and do-it-yourself procedures at home, leave it to the experts na lang.
Kasi, minsan sasabihin, nako, dito na lang ako mas matipid to.
Ayun nga, but...
Pero, pag may nangyari...
Yun. Then, that's the time you go to a dermatologist na, you know, for us, parang kami yung troubleshooter, yung ganyan ba? Yung mga ganyan. So, stay away from that. And then, of course, ito lang yung, just to, lang yung moisturizer, ito yung types, may occlusive, and then may humectants. Ito yung it absorbs water. Yan yung difference ng dalawa, no? That's why you have to know, no? And you have to know your skin type also, okay? And you have to know also if there's an underlying problem of your concern. And then these are the natural factors that may prevent skin dryness. These are the things that you may be able to read in your products. You have urea, you have lactic acid, glycolic acid. But as I've said, if it's an over-the-counter, be careful because it should not be that high percentage because it may be stinging. You know, the higher ones should be prescribed by a dermatologist. Okay? And then, of course, sun avoidance. Okay? It's very important. You avoid the sun from 10 to 3 in the afternoon. That's the worst part of the day. If you can't really avoid that, then you have to use a sunscreen and you have to reapply the sunscreen every 2 to 3 hours, okay? Or after swimming or after washing, kahit may nakalagay na water resistant, okay? So the sunscreens may be, pwedeng inorganic or organic, no? Yun yung mga usually yung mga titanium or zinc oxide, these are very, very nice, no? The only thing before na hindi mag-aano nito is kasi medyo maputi. Pero with the technology now, may mga micronized already, so hindi na siya ganun kaano, no? And for children, sunscreen 6 months and above would be okay. You have to be careful for infants 6 months and below. Okay. You know, so more or less, pag 6 months or below, ang mga avoidance mo lang dyan sa sun would be yung clothing. Put hat, or yung stroller, may cover, yung mga ganyan. But if hindi mo talaga ma-avoid na ma-expose yung baby 6 months and below, go more for zinc or titanic oxide na ano, no? Tapos, yung mga ibang paba, medyo nawawala na to sa market because maraming nagkaka-allergy dito sa chemical na to, no? That's why stay away also from paba. But bihirang-bihira na lang ang may sunscreen na may paba na ingredient, no? And then, of course, yung UV light penetration. And then, ito yung sunscreen application. Ito yung sinasabi naming 1 teaspoon rule. So for the face, you have to use half teaspoon. Okay. And then also for your arm and for the arm. But for the body and your legs, it has to be a 1 teaspoon. Okay. Otherwise, minsan hindi mo na gagamit yung sunscreen ng tama. And if you don't use it the right amount, hindi mo nakukuha yung protection. Okay. Kaya nga minsan ngayon may mga spray, no? It's easier to use, pero minsan yung quantity hindi mo masyadong nami-measure. And be careful also, minsan you forget to do yung mga behind the ears.
Ito lang yung nalalagyan.
Yun, no? Or dito sa may upper lip area or low. Ano yan, kailangan na nakakalat mo siya talaga, no? Yun ang importante. The sunscreen application and correct usage, no? So that will be the last slide, and this is from Sophia Loren. There is a fountain of youth. It is your mind, your talents, the creativity you bring to your life, and the lives of people you love.
Amazing.
When you tap this source, you will truly have defeated age.
Beautiful quote.
Oh, diba?
Ang ganda.
Oh, yeah.
Kaya talagang, yung sinabi niyo, Doc, kanina, it's not just about the physical, and you have overemphasized talaga. Holistic. And from within.
Yes.
Nakita talaga natin today, mga kaibigan, how lifestyle plays a big role in aging gracefully.
Yes. Because you exude whatever is inside,
That's
diba?
Right. Talagang, it should really start from within.
Kahit na siguro kung ano nang napagawa mo, pero deep inside you're depressed, you're stressed, it still shows. You know, you can't even smile beautifully.
So whatever you own, whatever products you have put in your body, talagang yung aging gracefully kailangan exudes talaga from within, sabi niyo nga. You should be able to smile, kung namamanage mo ba yung stress mo, nakakatulog ka ba ng maayos.
Peace of mind, you know, you sleep well, you know, and things like that. That's the essence of aging gracefully.
Beautiful, wonderful. So, Doc, I wish we have more time, but it's time to wrap up. Talagang, maybe we should have a part 2.
Akala ko maiksi lang tong lecture ko, pero mahaba pala.
How will our viewers be able to reach out to you?
Oh, okay. Well, I'm a consultant here at Adventist Medical Center, Manila. For now, because of the pandemic, my schedule is at Wednesday, 3 to 5, and Friday, 2 to 4 at the outpatient department.
All right.
Okay.
And syempre, you have seen a while ago, Dr. Philip Buñag is actually best friend of Dr. Vicky Bello.
Yes,
so
we're very
look for
good
him
friends.
also.
So I'm with the Bello Medical Group, but my role is more administrative and things like that. So I go around all our 13 clinics in Metro Manila. We have one in Davao. We have one in Cebu. We just opened one in Clark. Okay, so that's our newest baby. Okay.
So maraming ways how to reach Dr. Philip Buñag. But overall, mga kaibigan, I hope and pray that you have learned how you can be able to take care of your skin and age gracefully. Marami pong salamat sa inyong lahat na tumutok at sumubaybay. Thank you, Dr. Buñag.
Thank you.
Until next time.
Thank you so much.
Huwag niyo pong kalimutan, sumubaybay sa ating programang Voice of Health Monday, Wednesdays, and Fridays, 11 to 12, and sa DWBL 1242, 12 to 1 naman po ng hapon. Marami pong salamat. Don't forget, we always tell you this, and I hope na subukan niyo po ang inyong mga natututunan dito because it's true. Your lifestyle is medicine. Bye!
Bye!